And it's a great pleasure to welcome my next two guests who I think are at the leading front line of, see, I keep talking while they sit, so that by the time you get to speak, there'll be plenty of silence and attention. So, I didn't know up to last Friday what data interoperability is. And I always ask the idiots questions, and it is taking all of this technology to do with EHR, medical records, and saying, oh, James's hospital has this on me, and I was on holidays in Tralee, and this happened, and my GP, of course, has this, and the community care setting has this, is to try and ensure the ultimate objective is that the patient owns their own records and you don't have repeat duplication of all the very costly tests that need to be done. And it's easy to say, you know, a seamless patient journey right through all the healthcare systems and settings, but achieving it is the goal. And I'm now joined by two gentlemen. Thomas Sharkey is the healthcare lead in the Republic of Ireland. He's a Donegal person. I'll try not to hold that against him. But his day job is that he works for Amazon Web Services, AWS. And he's had a glittering career across different, Thomas had, of different aspects of tech and obviously, Amazon Web Services is a global giant. It supports both the public and the private healthcare systems. And I suppose, in simple terms, they're trying to usher in a new era. And I think you're going to hear today, one of the things that I learned in preparing for this, is that cloud capacity is greatly going to transform what can be done. Now, Thomas is going to explain this. And nearest to me then is Mike McCann. And he's the group, I told you they're the most important people in the organisation, Chief Information Officer with Blackrock Health. And you'll be aware that there was just the Blackrock Clinic, now it's the Galway Clinic, Hermitage Clinic, Limerick Clinic. But you'd think very hospital-centric specialised services, I had my back operation done in Blackrock, would be just dealing with better inpatient services. But the interesting thing is, in speaking to Mike, how they really want to improve health economics by shifting things remotely as well, all for the betterment of the patient. So let me just ask you both, first of all, to set out, because I notice it depends which end of the telescope, HSE or clinician or tech company you're looking at this whole debate. From your perspective, what does data interoperability, a seamless patient journey, mean for Blackrock?
Yeah, so in Blackrock Health, it means for us, as soon as the patient comes in, we have the right data, the right time, at the right place. And we make sure that whatever data we capture within the hospital, it isn't just kept within the walls of the hospital. So actually the right level of communication is going back out to the caregivers. Because ultimately for us, it's around making sure that we do the most effective care. We make sure that the right people are involved, and at the right time we share that data around in a very controlled and secure way.
And how are you getting on with that?
So we're in a stage where Blackrock Health was formed earlier this year and brings together 3 organisations and a clinic in Limerick. We're at different stages of digital maturity, but a lot of people be aware we have probably, definitely Ireland's most digitally mature hospital in Galway Clinic. It's HIM stage 6. And at that point, we have a totally electronic system, patient care. There is no paper. We have complete device integration, and the whole patient journey is captured electronically. We are already sharing a lot of that data with primary care, and we're getting in, but our real view now is to try and share that in a more collaborative way through our consultants to enable remote monitoring and to be able to do that across the group. And I think for us, we would like to be part of kind of regional health information exchanges where we agree it's this data and we're going to share this in a secure way with the right caregivers at the right time.
And what are the obstacles to doing that?
Yeah.
The tech capacity, the investment,
Yeah.
the buy-in from the different stakeholders? What are your challenges?
Yeah, so I guess we're all at different stages of digital maturity. We all have different systems. We all have different technologies. But ultimately now, we do have an opportunity to start to share data in small amounts, the right data when it's agreed upon, and ultimately cloud starts to give that opportunity, because something that would have taken many deep investment or deep amount of technical resources can suddenly be accelerated by some of the tools we have in the cloud.
Okay, AWS, Amazon Web Services, obviously global, deep pocket, all the good stuff of a global giant. Ireland and data interoperability for patients.
Yeah, well, Ivan, in your usual humility, you said you didn't know what data interoperability was a few days ago, but you actually did. It was just how that is applied in healthcare. Data interoperability goes back to the 80s, when a hospital may have had one system and then moving to two. Typically now there can be 40 and 80 systems, and they're working across different groups. The proliferation of data is massive, and the consumer and the patient's expectations of what they want has been driven by everybody using their phone as the way that they organize their life and their information. So data interoperability is the ability to share that data, to access it, and to do something with it, as Mike said, to provide for better patient outcomes with the right care in the right place at the right time, and also enable great efficiency operationally. So interoperability for us is providing our customers and partners with the toolkits and the services that allow them build applications, develop new offerings, new care modalities that they can then provide to their populations, to different cohorts, and to allow them do that so that they get the ability to look at population health. So that's managing our citizens at a large scale or a group within that. Provide for precision care by having absolutely very specific data about individuals at the point of care, and simply allowing clinicians to do more easily, so that you've got more work done, more people through the system, and all of this then, this data set is reusable for uses that we mightn't even imagine at this stage.
And maybe just to give an example of that we're seeing. So very recently, we've adopted in Blackrock Clinic one of the leading robotics technologies, but robotic surgery has been around for a number of years. I know Ronan mentioned it earlier on. But what's interesting about this is we're taking the data that comes from a CT scan, we're uploading it into the cloud, and then what's coming back is basically a guided, personalized medicine surgery to basically guide the surgeon through. And what we're finding, as my colleague Niall Hogan would say, is it's ending up with people who are in less pain, and we're getting them out of hospital quicker, which ultimately is what it's all around. And that's all from sharing data through the cloud.
Best in class, one of you mentioned the Cleveland Clinic to me. Yeah. Just discuss what they're doing that we're not doing.
Yeah, so in Blackrock Health, we've recently signed an agreement with Cleveland Clinic to help assist us in how they build a health network. So, they've grown a health business out of the US that's now been replicated across the world in various locations. But one of the things they've done is they've built out from their acute care into networks. So they've been able to share their data across primary care, community care, coupled with the latest technology. So one of the things we're starting to do is have remote sessions with some of their leading consultants in London, in Ohio, with both our consultants and patients, to be able to share some of them common care pathways and really try and learn from some of their expertise.
Okay, do please submit your questions in real time on this, and we'll get them in. Let's talk about money, Tom. Is this very expensive?
So there's an investment, but what we see is that people achieve a great return on that investment. So as a country, we've invested greatly in healthcare over the last 20 years. And we've done that to improve, I think the life expectancy has gone up by 6 years over that period. We're really towards the top end of similar countries in terms of the money we spend. I think that we're at a point where we can double down on that investment in terms of the effect and the impact it has by ensuring that where we can gather information about citizens. We do it in one place, and that doesn't have to be AWS, but it has to be somewhere where it's easily accessible and reusable. And when we do that, we'll see efficiencies and a great return on that investment. So yeah, there's some upfront investment. We work with organizations to form strategic partnerships where we enable them to, I suppose, get their toe in the water, understand what cloud can do for them, and then make a business decision on the basis of kind of understanding what the output will be and what the impact will be. So it isn't a blind investment, I would say.
I'd like to ask both of you to give us a timeline of where you think that we would be. Like the sort of simplistic idiot's version I have of it is that I have a USB stick, right? And I can go to my GP, I can go to James's, I can go to Blackrock, I can go to, some community testing centre, a primary care centre or whatever, and I'm the owner of my records, perhaps overcoming the GDPR because I'm the owner of it, I don't know. When do you think that vision, or is that a correct vision, is realisable? Is it 2 years away, 5 years away, or what?
We would say that we wouldn't require you to have your little pen drive, that you should be able to access your information and provide access to others for all of your information via cloud services, and that is, I suppose, more of there has to be the will to do that rather than understand is it technically possible, because it is technically possible, and other countries and other jurisdictions make that available to their citizens.
Well, is there a GDPR issue? In other words, how dare you have my records? How dare you give my records to someone else?
Well, if you're in control of it, then you make a decision as to what data you want to share with others.
Right.
So GDPR is where I take your data and provide it elsewhere.
Yeah.
So fundamentally with AWS, GDPR is something that we're audited on. Our systems are they allow you to accomplish your GDPR requirements, but it's up to the user of cloud services to determine what they are and then formulate their use on that basis. So it's down to that care provider, what they do with your data, but ultimately if you have the ability to share your data, then you make a decision what you do with it.
Mike, timeline?
So I think I'd say, Ivan, we have a lot of pockets of it happening right now. So, we have a lot of remote monitoring clinics going on where we have people at home with their devices. They are doing exercise every day. They're inputting health data. They are in control of that data and what they send into the hospital. And we're able to then manage their care and ultimately keep them out of coming physically into hospital, which is the aim. I think what we do need to do, and just maybe touching on GDPR, is I think at a national level, we need to make sure we're clear on, the minimum viable amount of data that needs to be shared across settings, and make sure that is what is shared, because there isn't a necessity, and I think there is so much data out there, we can sometimes try and eat the elephant. We don't need to share everything across settings. What we need to share is the pertinent data. Like I have some of my GP colleagues who I think are probably the most frustrated because they, at the end of the day, became digital a number of years ago, and you very rarely get a piece of paper within a GP surgery. I think what we need to be able to do is be very clear on that data that needs to go back to them, because ultimately they are generally the primary care provider with most people, and try and do that in a quick and efficient way with everyone inputting into it in the way. So I think we're in a place where we can grow pretty quickly. We have things in place. The cloud allows us to accelerate that journey, and we need to get on and do it.
So the answer to my question of a timeline is what?
So I believe if we were to very much specify that data, we could do it in a matter of months. And it really is, because given the cloud, we have that acceleration. We have a lot of data there. We're not short of data to share. It's actually just around coming together, agreeing that, and coordinating it.
Okay. Either of you can pick up. I have a range of questions here. Can you give some insights on the importance of the use of data standards for interoperability? Data standards.
So I think if you look back, so standards are very important. It just means that you can make that data accessible and shareable without customization. There are a number of standards out there. A recent one that's growing in popularity in the US is the Fast Health Interoperability Resources Standard. That's based on the HL7 organization. This is something that we have actually an open source toolkit which allow developers create new applications which allow them share data. Without standardization, you have the opportunity for various pockets to...
And who is it? Is it HPRA? Is it HICWA? Who does the standards here?
So within Ireland, there are 3 groups that look at standards. So
Wouldn't you know there's 3, right?
You know, that's maybe more in other countries. But you have HICWA, you have an office within the HSE, and you have the HSIA, or the NSAI. And I think that HICWA's report from September of last year talked about the benefit of having one group own and manage the standards, and that they are clearly identifiable and the people work to those, and that allows us move forward, and there's certainty, and that would make things much more easy for developers to work to.
Okay. We have found one of the biggest barriers to digital transformation in acute care is sufficient staff associated to IT projects for implementation and ongoing support. Huge issue is big tech in Ireland attracting much of the talent. How, and of course we've all the tech giants here, how can the health service compete more effectively? That's straight into you really, Mike. In other words, the staff to operate this.
Yeah, well, it's the staff to implement it. I mean, it is a challenge, right? I mean, I think some of these technologies, if they're going to be successful, I think Tim talked around it, the vision needs to be out there, and it needs to be led not by IT, it needs to be led by the caregivers, the business. Attracting those people in, actually, often people do want to come and be part of these projects, they do want there. It's actually the backfill of them people, because the real struggle is getting the clinical staff and obviously retaining that, and we all have them troubles. I don't think we should be pitting against big tech. I think actually what we should be looking to do is partnership. So for instance, one of the reasons and the attractions of cloud for me is because it has a lot of inbuilt security, it has much easier development, it has much lower actually technical input. So, you know, we should be looking to partnership, as far as I'm concerned, with a lot of the big tech firms to try and minimize that burden. Actually, what we should be bringing in from hospitals is our expertise from a clinical perspective, from an operational perspective, design and build it.
Mike, can best of breed BREED systems provide the interoperability and the seamless patient journey everyone has as their main outcome?
Yes, in a short answer. Like, I think, you know, we've talked probably about EHRs for years, and the idea that we might have one EHR across the country. I think the likelihood of having one EHR is very unlikely. I don't think it's happened in any country that I can necessarily think of. And that means we're going to have multiple systems. If you look at what, say, someone like the Cleveland Clinic have done, and a lot of American health systems that have moved into Europe as well, they've created health information exchange, which is standards-based with multiple systems. So I don't think we should let the barriers of multiple systems stop us sharing data.
Absolutely.
Yeah, one for you, Tom. Data interoperability brings data cybersecurity challenges. Where does the responsibility to secure data reside on? How could blockchain assist in this task too?
Right. So in terms of, if you look at our approach to data security, we very much have a shared responsibility model where AWS provides security of the cloud and our users provides for their security in the cloud. So it's very much understood who is responsible for what, and that's, you know, part of the engagement with AWS. But our systems are secure by default, and then you decide what is important for you to allow you share data. So there's a lot of work has gone into this. I'm no expert on blockchain, and I can't answer that aspect of the question. But one thing I will go back to is just your question about talent and the war for talent that's out there. And what you find is that a lot of cloud services take away the undifferentiated heavy lifting or the basic feeding and watering of IT systems and allow then your staff to work on something that may be more interesting and more impactful to the organization. So it's that idea of we're just going to leverage compute, storage, networking, and get access to a number of systems and let our people work on the thing that's going to impact patients most.
Now, Tim Hines spoke about shared, inspired vision. Yeah. Someone's having a swipe here at you. Is Blackrock's understandable focus on its own network not a classic example of siloed innovation, contrary to the parceling up concept referred to by Tim?
No, not at all. So I think we have to be honest, given COVID and given where we are as a country, that, you know, the waiting list and access is the biggest challenge for everyone. And, we have 450 beds. We're one of the biggest hospital group, I think, across the private hospital group. There's close to 2,000 beds. The reality is we need to be able to use them to help with them access issues. And we're already doing a significant amount of public work. And I think one of the biggest challenges is the data share between public and private hospitals. So if someone's coming in to have their knee done in a private hospital, how do we make sure that follow-up back in the public hospital is significant from a data sharing perspective? And I think exactly with our GPs, our GPs are referring to multiple public, private hospitals. The information we give back to them needs to be consistent from whatever care, because as I would say, 50% of people have a level of private health insurance and are probably going to touch the private hospital system at some point. They need to be able, that data needs to come back into an overall health record that is seen by the caregivers in other settings.
Okay, Judy asks, unique health identifier necessary for all this, is it ready for use in Ireland?
Well, I think that certainly there's a use case for it and a need for it. I believe that during the COVID pandemic, we have now a capability to identify all the people in the country who received a vaccine. And then the question is, could that be used as the unique health identifier? There are decisions then that have to be made within government in terms of policy and within HSE in terms of execution and delivery. But absolutely, if you look across health systems globally, the need for unique health identifier is at the foundation of being able to deliver.
And is Ireland ready?
Mike?
I would say that we're already sharing data in a lot of settings without necessarily that unique health identifier. I think it would help if it was fully in place and ready, but I don't think we should let it be a constraint to sharing from some of our legacy systems. And I think if you look at what we're doing with GPs, we're already doing that. I think it's something that is ready, and new systems will be adopting it. And as we keep on adopting new systems, we're in a much better place. But we shouldn't worry about all of the older systems that we currently have.
Last question I have is from Kerry O'Hanlon. Is a greater understanding of GDPR within healthcare and among healthcare users required in order to overcome this as a stonewall barrier to embracing this step in personalised digital healthcare?
I think that there's a potential across public services for a greater understanding of GDPR and
what bit do they not understand?
Well, I think it varies place to place, but sometimes you get the answer that I can't provide that information because of GDPR, and it's just a barrier to
it's bullshit, is it?
Transparency.
Yeah.
You said that, not me, but look, I think that GDPR is worthwhile legislation.
But we do have a data commissioner, and public officials do have a special responsibility, not to err on the wrong side of that.
Yeah, I think that, again, it's comprehensive understanding of what the GDPR requires.
Okay.
And how
Final question from me. And because I like to have a single takeaway for people. So, in relation to data interoperability, what is the one thing that needs to happen to accelerate this more than anything else right now in May 2022 in Ireland, after the cyber attack, after the pandemic, given Ukraine, inflation and all these swirling problems, an extra million population, explosion of older people living longer? What's the one thing we need to get right now?
So I think the one thing we need to get right is actually the level of data that we define as what needs to be shared, and we need to try and put that in the hands of the patient as much as possible and actually get that out as a public information campaign to patients, to what they can expect to be shared, to actually avoid that fear that you talked around, which is GDPR and inappropriate sharing.
Okay, so who needs to do that?
I think it needs to be a coordinated effort. I think probably between the public system, the private system, then we need to come together and actually define what that level of data is and how it's going to be shared and appropriate.
Well, we're going to hear about this Tullamore Declaration in the afternoon. Martin Curley, the HSE people are all here, and they will be on the panels as well. Okay, the single biggest accelerant?
Yeah, I think that, look, defining the objectives, what do we want to get out of this? And I was at the Tullamore event, great event, and actually when you talk about innovation in not a vacuum quite, but within Blackrock, Jimmy Sheehan gave a great presentation on the things that have changed within healthcare over his professional lifetime. And I think that when you have exemplars like Blackrock Health, where they've brought new technology to the public, it's great, you know. So I don't think it's a case of kind of innovation behind closed doors. It's innovation which sets an example and is aspirational for other people. I think that we need to understand how we are going to support, as you say, an aging, increasing population with more long-term issues, and then understand where that support can most easily happen. So probably just like getting objectives and agreements about how we do this down on paper and working to that.
Okay, a single hymn sheet.
Yes.
Okay, right. I want to thank sincerely, you've heard there, Thomas Sharkey of Amazon Web Services and Mike McCann, the Group CIO for Blackrock Health. Please show your appreciation. Thank you, lads.